Little boxes on the hillside, little boxes made.
I'm Jane Garrity, and welcome to my podcast. A Gift of Time is my memoir of my self-healing and spiritual awakening and psychic path. I speak about generational trauma and traumatic events that are personal to me and shared as my perspective. Once we figure out who we really are is when the real healing can begin. Trigger warning. This episode discusses life-threatening condition in pregnancy called HELLP Syndrome and traumatic events. Episode 4, 1997. I laid in my hospital bed, barely able to move. It felt like my body was being weighed down by layers of bricks, and I was still feeling numb from the epidural. The events leading up to my C-section were scary, and I don't remember them all. My husband was standing next to my bed crying and telling me what happened and how our baby was doing. All I could think of was, I want my mom. I need my mom. And then she walked in. My mother was finally here. She was able to get a flight from Albuquerque to Boston that morning after what I am sure was an agonizing week of processing and thinking about when she should fly in. I had already been in the hospital for a week under bed rest and observation for preeclampsia. I was sick of being in the hospital, but I had no power of my own. It happened so rapidly. When I went to the doctors for my normal monthly checkup, and my blood pressure was up, and my urine sample showed a significant increase in protein. I was immediately sent to the hospital for blood tests, and they ended up admitting me that night. I had to call my husband's work. We didn't have cell phones back then, and he was on the road, so I had to leave a message that I had to go to the hospital because of my blood pressure, and they needed to check me and the baby. They kept me a couple of nights to make sure that I was rested. My blood pressure lowered and remained stable. Once they felt that I was stabilized, I was able to go home that third day. However, I was to remain in bed at all times. I could go to the bathroom, and that was it. The plan was that a visiting nurse would come to check on me daily to assure I was remaining stable. I had already quit my job at the Visiting Nurse Association a couple of months prior due to the extreme back pain I was experiencing, so we were a one-income family at the time. My husband was still just 2 years in with his company, and he had limited time off at 2 weeks per year, and he was saving it for when I gave birth. My stepmother and mother-in-law quickly rallied to help out. We had a toddler at home. They collaborated, strategized, communicated clearly, and took control. The only thing that I had to worry about was strict bed rest. Shortly after I got home, the nurse came. She said my blood pressure was too high. My condition had already worsened. In a matter of hours, I was sent back to the hospital the same day I was let out. Once I was admitted back into the hospital, I was poked, prodded, and my veins were connected to an IV. I was only to get out of bed if a nurse or someone was with me, and I was ordered to rest in a darkened room. I was having my blood drawn intermittently, and I had to have an ultrasound to check the baby, along with my liver and kidneys. My blood work was showing signs of elevated enzymes in my liver, and they also needed to see how far along the baby's lungs were developed, so that they would have an idea what he would need should I have him early. All I knew was that my body was rejecting the pregnancy at 34 weeks gestation. It is now known as HELLP Syndrome, HELLP. Hemolysis, elevated liver enzymes, and low platelets syndrome is a life-threatening pregnancy complication usually considered to be a variant of preeclampsia. Both conditions usually occur during the later stages of pregnancy or soon after birth. When my doctor came in the next day, he explained to me where we were at and what my options were from this point forward. He said that my condition was progressing rapidly, more than he had actually ever seen, and he was concerned for my life and the baby's life. My options were to fly to Dartmouth Hospital, where they have the teams, expertise, and the capacity to take on a life-threatening pregnancy, but there were no guarantees due to the rate of my progression. The goal was to keep the baby in my womb for as long as possible. The other option was that we could start measures to induce labor. He explained that since I wasn't to term, and the ultrasound showed that the baby's lungs weren't developed yet, so that when I did give birth, he would be in the NICU for a while. I didn't fully understand the gravity of the situation. I was just feeling terrible and frustrated at the same time. One of my aunts had called me the week prior to see how I was. She told me how their mother, my grandmother, died while in pregnancy due to liver complications. I still didn't understand. I wasn't connecting any dots. By this time, my mother had returned to college herself and became a respiratory therapist. She had experience with the NICU and caring for preterm newborns whose lungs weren't developed. So I let that thought go, knowing that my mother would be here soon and it would be all right. She would be here to take care of him and me. So that next day, it was decided that we would start the process to try and get my body to go into labor. Gel on the cervix, shots of morphine for pain, the constant poke of blood draws, a magnesium drip to help keep the blood pressure at a manageable level. I would not have the baby that day. None of the induction tactics were working. I sent my husband home so that he could be with our toddler, and they both hunkered down for the night at my in-laws. He was distraught, worried, and didn't want to leave me, but I insisted. Didn't want our oldest to be without both of us for even a night. My friend at the time was there, and she spent the night with me instead. I woke up the next morning for more of the same. Drips, pokes, blood draws. It was pure misery. My husband came in first thing and spoke with the medical team. He didn't know how to comfort me. I was shaking, feverish, and so miserable and unable to really move, and he got scared. I told him that he better go get the doctor because this baby needs to get out of me. I can't take it anymore. He left the room and ran down the halls, and then he, the doctors, and the nurses came rushing in. Everything happened so fast after that. They wheeled my whole bed into the operating room. My friend was still there, along with my husband, and thank God they let them come into the OR with me. I was terrified. I needed their presence to help me feel some sense of safety and comfort. I didn't know what was going to happen next except a C-section, which was scary on its own, let alone not knowing if my baby was going to be okay. Would my baby be breathing? Was he too little to breathe on his own? Will he need a respirator? Will I feel them cut me open? I want my mom so bad. I knew she was on her way. I need my mother. I just want my mom. I laid there on the operating table with the lower half of my body numb, while my husband held a basin for me to vomit in. I don't remember much, except they cut me, and my baby was taken from my womb, and I waited to hear his cry. And I heard it. Thank God, he's crying, he's alive, he's breathing. They showed him to me, and then took him away. I thought they took him so fast because something was wrong with him. They took him so fast because of my condition. They had to finish the C-section, sew me up, and try to get me restabilized. They also had to take him to check his lungs and vitals and get him to the NICU since he was premature. He would be fine, they said. My husband and I both cried with relief. It was quiet now. As I laid in the bed, not able to move, still paralyzed from the medications, my husband was crying next to me. I wasn't allowed visitors, but after much pleading to the doctors and nurses, they allowed my in-laws and stepmom and dad in for a quick wave, so they could see that we made it and to let me know that they were here for us, praying for us, and rooting for us. It was comforting. When my mother and my aunt walked into the room that evening, I cried. She made it. My mom is here. I can relax now. It was a long and terrifying day. I was so happy to see my mother. I sent my husband home again because I didn't want our toddler to be without a parent, and I also knew he needed a break and rest too. It was just as terrifying for him, feeling helpless and not knowing how things would end. I know he wanted to stay with me, and I know he also wanted to be with our toddler. I know he felt torn. We all need our rest. You'll sleep better, I told him. I had my mother stay with me. She pulled open the hospital chair into a small bed, and the nurses brought her a pillow and blankets. I asked her if she saw my baby and how was he. She said he was doing just fine. He was on a respirator and warm inside an incubator, and he was strong. That kid came in weighing 6 pounds, 3 ounces at 35 weeks. All I could think about was that if I did bring him to term, he would have been 9 pounds. Just because I had the baby and he was out of my body didn't mean I was miraculously better. I would learn that my body was still under much duress. I had a nurse stationed at my bedside for the next 24 hours as I needed around-the-clock monitoring. I had a small tube attached in the middle of my spine that was connected to morphine. My blood was drawn every 30 minutes, and the backs of my hands and inner arms were bruised from the constant needle pokes. I would learn later that I had been having seizures. What it felt like to me was that feverish, uncontrollable bouts of shaking, and then it would subside. As my mother laid with me, she told me how her mother died. She was just 13 and the oldest of 4 girls. Her mother was pregnant with the 5th. When she was 8 months pregnant, she was sick and went to the hospital. Her and the baby would end up passing away from a failed liver. Back in the 1960s, they didn't know what it was. They still didn't call it HELP back in 1997. It was just a complication of eclampsia. She told me how when they buried her, they wrapped up the baby too and placed him at her feet. When my doctor came in the next morning to check on me, my mother had already met with him and shared with him how her mother died. He said, well, that would have been something to know prior to all this, and he was just as thankful as we were that I was on the path to recovery, and my baby was too. I still hadn't seen or held my baby yet. I didn't even know if I could hold him. I wasn't allowed visitors except for my mother and my husband. Too many visitors would have made my blood pressure worse, and I needed as much calm and rest as I could get. As I approached the 24-hour mark after the operation, the nurse was able to move her station back out to the floor. That evening when things had calmed down, the nurse came in and she said she had to change my sheets. She said, well, I can move you around to change them, or if you feel up to it, I can get you in a wheelchair and bring you to see your baby. She helped me get into that wheelchair and brought me into the NICU. I could not stop crying. He looked small, a little purple, and had tubes and wires sticking out of him. He was doing great, though, tough little guy. It didn't last long, as I was still restricted to complete bed rest. My blood pressure was still too high. All I remember is the top number was hovering around 200. I still had a catheter in because they didn't even want me to get up to go to the bathroom. The next morning, my condition was slowly improving. I was able to have a couple of visitors, and I was feeling more coherent. That afternoon, I was able to be transferred to the postpartum floor. I was able to stop in the NICU on my way to my new room, but I was still on bed rest, and he was still attached to wires and needles and a respirator. 48 hours have gone by, and I haven't held my baby yet. I went to the postpartum family floor to continue recovery, and I heard all the families laughing, joyous and happy, doting over their new babies. All the while, I couldn't even see mine, let alone hold him. My mind and thoughts were coming back on track from the trauma, but my body still had a ways to go. By the 3rd day postpartum, my doctor came in to check on me, and I jokingly told him that I was ready to hang myself by a bedsheet out that fucking window if I can't go to the bathroom or even take a shower soon. He laughed at my joke, but also knew that there was some truth to it. He said that if I could get my blood pressure numbers lower, he would take out the catheter. And if I could get that lower number to under 100, I could take a shower. For fuck's sake. I had to stay calm and rest. Hearing all the other families on that floor didn't help. I wish I wasn't on this terrible floor. That afternoon, the nurses came in to take out my catheter, and my stepmother came for a visit. She spoke with the nurses and asked me if I wanted to take a shower. She helped me to shower and put me in a wheelchair to visit the NICU. They just didn't want me to move because every time I did, my heart rate and my blood pressure went up. I was still in the danger zone. I was constantly telling my mother to check on him, making sure he was fine, and she was, and he was too. But there was only so much she could do. She didn't work there, but she knew how to communicate to patients and translate medical jargon, as well as be an advocate for me and my baby. It felt as if she became a respiratory therapist just for this exact moment in time. My husband had already used all of his PTO while I had been in the hospital, and he had to get back to work. It didn't matter the trauma that we had just experienced. No work meant no pay meant no home. He didn't have a choice. By the 10th consecutive day in the hospital, my doctor said that I had stabilized enough to go home. Normally, he would not have let a patient go home at this stage, but because my mother was here, and with her medical experience, combined with being my mom, he trusted that if she was staying with me, that I could go home. I had strict rules to maintain. No lifting my toddler, no lifting anything. Rest, recovery, not even leaving the house, not even to go and see baby. I was now taking blood pressure medicine, and I would continue to take it daily for months after the birth. I was grateful. I was feeling anger and jealousy hearing all those happy families and new babies in the rooms around me while I was stuck in bed. I still hadn't been able to hold my baby. He wasn't allowed to come out of the incubator. I decided that I needed to put an end to my suffering and continue recovering at home with my 2-year-old. It felt like the medicine I needed most at the time. My mother unpacked, we set her up on the pull-out couch, and my husband was back to work. My oldest would toddle into my room in the mornings after my husband had gone to work, and we would snuggle in bed. I had missed that so much while I was in the hospital. It was our time. My mother was there to do all the heavy lifting, and my one job was pumping milk out of my breast and throwing it into the freezer. The hospital sent me home with a machine on wheels to pump my milk. I would joke that I felt like a cow. My husband would bring my frozen breast milk to the hospital for the baby, and then he would bring home Polaroids from the nurses, and I was jealous that he got to hold the baby before I did. It was 2 full weeks he would be in the NICU, and then he was well enough to come home, and I was well enough to take him home. My mother and I had gotten into a good routine. My oldest would wake up and tiptoe into the living room in green footy pajamas and wake up my mother wanting to play. My mother would get up, close my bedroom door so that the baby and I could rest, and she would start the day with breakfast, Sesame Street, and the newspaper. I loved having my mother there. I felt safe, supported, and secure. She became my steady and stable rock during that time. Even though I had already had one baby, the trauma of this pregnancy and childbirth brought new fears and uncertainties that I didn't expect. One time when I was changing his diaper, he seemed to have stopped breathing. It was like he choked on spit or something, and I began to panic. "Mom!" My mother came rushing in since I was screaming, and he was fine. He was breathing fine. She said it was okay. He was okay. I was paranoid. Every little hiccup he had, I was terrified that he would stop breathing and die. My baby was in the NICU for a total of 2 weeks, which felt more like 2 months. Once we were all home, the ordeal officially over, my husband and I watched him sleeping in his bassinet, and we held each other and cried. Those 6 weeks of recovery after the trauma of that childbirth and having my baby cut from my stomach, my mother lived with us. She left her home, her 2 teenage daughters, and husband in Albuquerque for 6 weeks to help care for me and my children. I'm not sure that I could have done it without her. This was also a time for us to bond in a different way. I was now a mother too. I was 26 years old with 2 babies of my own. It gave me a better understanding of my own mother. All the things I thought I loathed about my mother were now becoming the exact same things that I loved her for. How must she have felt on that plane back in 1997 when there were no cell phones, no internet at our fingertips, having no connection and not knowing what the outcome was going to be upon arrival at the hospital that day. There is still much more research to be done for HELLP syndrome and women's health overall. Of the women who experience this condition, up to 24% of them and 34% of their babies will die each year. There is still no known cause. According to CommonwealthFund.org, the United States has the highest maternal mortality rate among developed countries. The rate is more than double the rate of other high-income countries. Some of the factors for having the highest maternal mortality rate are a lack of maternity care providers, especially midwives, limited access to comprehensive postpartum support, a disparity between white and Black Americans, with Black women experiencing a maternal mortality rate at 2.6 times greater than white women. More than 80% of maternal deaths in the U.S. are likely preventable. As I continue to navigate my body's transition into menopause, I will learn that medical research on women's bodies did not begin until the early 1990s. The National Institutes of Health Revitalization Act of 1993 became into legislature to incorporate large-scale research and the inclusion of women in clinical trials. This was just 32 years ago. This concludes episode 4. Thank you for listening. If you're liking and resonating with my podcast, please share it. If it's resonating with you, it's resonating with someone you know. Be sure to follow along, subscribe. Head on over to my website, innerhearthealingllc.com. Subscribe so my episode links get directly into your inbox, or head on over to my booking page and see what kind of psychic services I offer. Thank you.
Little boxes on the hillside, little boxes made